conjunctivitis. So that word conjunctivitis will keep appearing in the text, but know that it means the red eyes that we have been referring to. So Dr. Crescent, I'm humbled for the kind introduction. Thank you so much. So let's carry on. So I want, by the end of this session, members, everyone here present on call should be able to identify a person having red eyes, the conjunctivitis, and we should be able to carry out preventive measures in order to not to contract the disease, the red eye disease, and then also to acquire knowledge on how to care for those who get the red eyes. So before I take you through this scenario, I also want to inform the members that, red eyes, there was an outbreak, a confirmed outbreak of red eyes in Kampala by the Kampala Capital City Authority on the 13th of March this year. So let's begin with a scenario. Here, Mama Ken, aged 28 years, is a food vendor operating from a busy mall in Kampala. She presented to the community pharmacy with complaints of red eyes, irritation, and excessive tearing. Then in addition, she states that this started about 2 days ago and described some discomfort, but there was no eye pain. And then she also says she does not use the contact lenses, but also reports that one of her colleagues is also having red eyes. So you can see that points towards the outbreak. So it's more, an outbreak will affect more than one person at the same time. Like you find a group of people affected at the same time. So what do we define as red eyes? So this is the inflammation of the conjunctiva. That is the white part of the inner lining of the eye and the eyelids. So it is reported as one of the most presenting disorders in primary eye care. So if you look in the picture that I've shared here on my left, it shows I'm trying to show you the conjunctiva, the white part that we're trying to talk about, which turns red, and then we refer to the eyes as being red. So what causes these red eyes? So there are several causes of red eyes. It could be viruses, it could be bacteria, it could be allergens, it could be trauma. I've just listed a few here, but there are several causes of red eyes, of which when you come to the hospital, we have to rule out other causes of the red eye. There are so many, I could not list them here, but the most common that we are going to look at tonight, of course, are the three, but in respect to our discussion tonight, which is the epidemic that we have had, it's more of the virus, the viral infection. So if some of you have come to hospital and we have told you, you have allergy and you've been wondering what is this allergy thing. So it is also, of course, one of the causes of red eyes, because you've come presenting to us, the itching, the redness and what. So some of you have told you, you have infection. So you're wondering now, infection. Yeah, so it's either a bacteria or a virus. Yeah, and of course, some other trauma, chemical use. So, okay. So it is also important to note that the viral and bacterial conjunctivitis, so the red eyes that are caused by the virus or bacteria, are more contagious. And of course, them being contagious, So they can affect many people at the same time, just like I had stated. So this usually occurs in outbreaks, just like the current outbreak we're having here in Uganda. And it usually starts with one eye and progresses to another eye within 48 to within 24 to 48 hours. Although some might present at the same time, both eyes, but sometimes it might come to one and then eventually it moves to the other. But the good news is it is self-limiting. What do we mean? When all factors are left constant and you get this red eye, maybe it's a viral infection or a bacterial infection, eventually it will clear without you even putting the treatment. So here, one of the photos on my left is a viral infection. We're seeing here this patient having red eyes, and then the other one is the the bacterial infection, where we are having an associated discharge. So for viral infections, usually all of them have discharges, but for the viral discharge, it is usually a watery discharge. So these discharges, we describe them as clear or purulent, or the yellow discharge, like what we are seeing here left in the left picture here. So we can carry on. So when one has red eyes, how do they present? Just like I showed you in a case scenario there, patient was presenting with redness, itching, discomfort. So in addition, this is also what we have. A patient will maybe have pain. All these do not come in at once. They might all be there, but not necessarily that they all have to be in one person. One person might actually have only redness and then there's no any other symptom they're complaining of. Another one will have itching and discharge. Then others will present with reduced vision. Others will feel like there's something that has fallen in their eyes, like a foreign body in their eyes. And others will present with tearing, or the eyes are swollen, the eyelids and the conjunctiva, that white part of the eye which has, oh my goodness.
For YouTube.
Okay.
For YouTube. No.
Kindly try to control the people in the background to mute. Yeah, so thank you. Yeah, so those are the main symptoms. So how are these red eyes transmitted from one person to another? Remember, we've seen they're contagious, especially these bacterial and viral. And we've said it is what is happening right now. There's an outbreak. So most likely it is a viral and maybe a secondary infection with bacteria. So how do we get this transmission? The transmission comes in when we have direct contact of
my only sunlight.
Transmission comes in when we have a direct contact with contaminated hands or objects, that is surfaces that have been contaminated with another person's secretions from the eye, which are contaminated. So how does it come about? That is contaminated hand. So you yourself, you contaminate yourself, you have touched somewhere, a surface, or you've touched hands of another person that is having contact. Because remember, we keep rubbing our eyes, touching our eyes, so you leave the virus in your hands. And remember, these viruses are able to survive on dry surfaces for even a week. So you have it in your hands, then you're shaking hands with another person, so you pass it on to another person, and then you're putting in your eyes. Or infected tears. Here somebody's tearing, we're talking of discharge. So somebody cleans their eyes with a towel, a hanky, a piece of cloth, then you come and get in touch with it, and then somehow you also touch your eyes. So the chain continues like that. So how in other forms we are sharing, we love sharing. They say sharing is caring. So sometimes we share our money, we share our pillows, our bed sheets, our makeup brushes, our phones. So here, like I've told you, these viruses can survive on these dry surfaces for more than a week. So you can easily get infected and it moves on very fast, very, very fast. It multiplies so fast. Okay. So where are the places that are highly at risk of people getting infection? So we have these crowded places, highly crowded places, and these are the schools, we have prisons. You must have heard in the news that the prisons were having they recorded several numbers of prisoners with red eyes. And I remember somebody was saying they should just set free those prisoners and they go back to their homes so that they don't affect others. Then, of course, shopping malls and markets, and then places of worship, and people using public transport because we are seated close to each other, we can easily contaminate each other. Then saunas and steam baths, and of course, swimming pools. So basically, when you look at this, you'd wonder whether we should have another lockdown or what. I don't know. So when one gets infected with these red eyes, what are we supposed to do? Not to spread it to others. So we should really avoid touching our eyes as much as possible. But one is going to ask, how do we stop touching our eyes when we have to wash our faces, when we have to put medicine in our eyes? So how are we going to avoid touching our eyes? But here I would say, of course, I'll take you through how to instill medicine into your eyes. But briefly, what I mean by not touching your eyes is, let's say you're going to put medicine in your eyes. Of course, you're going to wash your hands before putting the medicine. And after putting the medicine, you still wash your hands. So in that way, you're going to avoid contaminating other people and other surfaces, and then carrying the germs on your hands. So, of course, stop wearing contact lenses. Yeah, there are people who put on contact lenses. You never get to know them unless they tell you that I'm putting on a contact lens. And then, of course, we apply a cold compress. This one here helps in relieving the symptoms. When you apply a cold compress here, we mean that let me show you in the next slide. So the first photo up there, the picture up there is trying to show that you should not rub your eyes, you should not have contact with your eyes. So the second picture is trying to demonstrate how to put a cold compress. You're going to hold a clean piece of cloth, you put clean cold water, not from the fridge, just normal temperature, room temperature cold water, and then you close one of your eyes and then place the piece of cloth on the covered eye for about 10 to 15 minutes. This helps to relieve the symptoms, helps to relieve the swelling. Yeah. And of course, after that, you have to wash your hands so that you don't contaminate other surfaces. So, of course, we should stop sharing our personal items. So here we have to be greedy, no sharing phones, no sharing money. So I don't know how we are going to make transactions. Okay, so we're going to apply artificial tears. Of course, these ones are prescribed by the medical personnel. Don't just go and just buy anyhow. Then, like the next point says, do not use over-the-counter medications. I've seen some patients come, maybe we had given their child or somebody, their relative, an eye drop, and then they are there at home, and then they get this infection, the red eye, and what, then they tell you that I shared the eye drop with my relative, the one that you had prescribed last time. And then the patient comes crying that actually they are not seeing Yet actually that medicine was used for treating something very different in that other patient. So here now the patient is telling you, I'm not seeing. Only to look at the eyes is the effect of the medicine that they use. So that's why we should not use over-the-counter medications or sharing medication anyhow. So we should always seek medical attention. So here we have another scenario. This is Jolie, a 6-year-old, brought in by her mother with complaints of redness of the eyes, her yellow sticky discharge deposited on the inside of the eye of her eyes, and then she also continues to narrate that the discharge is usually more in the morning and prevents this little girl from opening her eyes. But when we check, we find that the vision is normal, and then we make a diagnosis of a bacterial conjunctivitis. So of course now here, what I'm trying to bring to you, of course we had now talked of using cold water compresses and what, but in this scenario where there are discharges and then they are stuck on the eyelids and you can't open them easily, we are going to encourage you to use warm compress in this time to try to remove those crusting of the eyelashes, and you remove those discharges every morning to clear up the vision. Then of course you seek medical attention. Surely we have to treat if this is a bacterial infection. Although we say it is self-limiting, sometimes it doesn't go away. There are more multiple microorganisms, and then you find it is actually not going and it is worsening the vision of the patient. So I also want to bring to your attention the neonatal conjunctivitis or the neonatal red eyes, because now imagine a newborn. This is the neonate is from 0 days to 28 days, but now you find a 1-day child, a 1-day newborn is having red eyes, a discharge, swollen lids, and then you start diagnosing them with this epidemic red eyes. So that's why I intended to bring it here so that you also take in notice. So these neonates usually get these red eyes after having a vaginal delivery, no birth canal delivery, and so the transmission occurs during the passage through an infected birth canal of a mother. So, and of course, the symptoms they will present, like I've told you, they'll have redness, it may be both eyes or one, then having discharge, and the lids are swollen, the child is irritable. Usually that's why you have seen midwives giving tetracycline ointment, that eye ointment, usually yellow. They usually give it to newborns immediately they give birth. Before the child goes home, they usually apply that ointment. It is not for fun, or it is not, it is just to prevent this from occurring. But some still, even after instilling this, some still go on and get the infection. So you also have to seek medical attention. So here we are. How do you prevent this? How do you prevent red eyes? In a scenario where we've not had red eyes, how do we prevent it? So we encourage people to wash their hands, just like we did in COVID. So we encourage everyone to wash their hands frequently with clean water and soap. And or where there is no soap, like now, as like in the hospital setting where we have to see more than 10 patients, we usually use alcohol-based sanitizers, so that we don't keep moving to the hand washing facility. Every time you see a patient, you move. But alcohol-based sanitizer with a good concentration, 70% and above of alcohol, it is sufficient and it will kill these germs. Even clean water left alone, just clean water with soap, it is just good enough. You don't have to look for jig, is it what? You so just wash your hands. Then avoid sharing personal items, that is handkerchiefs, eyeglasses, pillows, pillowcases. Okay, then we have to wash our bed sheets with our bed sheets, pillowcases, and towels in hot water and detergent. Then we minimize contact with infected people. Minimize contact. I know these are relatives, these are own, but avoid contact or minimize where you cannot avoid. Then, of course, avoid handshakes. So like I said, we are going back to the COVID time where we have to not to shake hands. I think shaking hands is getting phased away slowly but surely. Then, of course, people who are infected, so like school children, health workers, and food vendors, they should stay at home in isolation until the symptoms have subsided. So, dear members, I also wanted to take this time to also show you how to instill the drops into your eyes, because I realized as I've been in practice, I have realized most people don't know how to put this medicine in their eyes. When we give you medicine, people are using it anyhow. Of course, one is you are not supposed to share eye drops. I've seen many patients here sharing eye drops. Tells you, no, I got my daughter got, then we shared, all the two siblings are sharing, like two children. So we really encourage not to share eye drops. So I think we are being mean here. We are talking about not sharing, not sharing. So I don't know whether this is fair, but it is good for the health of the community. So how do we instill these eye drops? So we wash our hands before instilling this treatment. Of course, dry your hands after washing them. Dry them with a clean piece of tissue or a towel, and then you tilt your head back or lie on the back. Then gently pull down the lower eyelid to make small pocket. This helps to make a small pocket between the eyelid and the eyeball. So look up and away while applying the eye drop and drop the prescribed number of drops of medicine into the pocket of the eyelid without touching the dropper. Let the dropper not touch the eye. You have to put it in space. That is very important because we have seen many patients, we are treating them, they are not recovering. But what is the reason? They are reinfecting themselves because now here the eye drop is touching on the eyes and then they are covering, and of course the germs are multiplying there. And they have even gone into the medicine itself, and then you're picking, you're putting again in the eyes, so you are reinfecting yourself. So like there is no work done. So of course, we usually encourage one drop. I've not seen where we are saying put two drops more, and many patients have also wasted the medicine. They keep you give a patient an eye drop, and then it tells you, within 2 days, the drop was open. Like, how did you use it? Because this eye just needs one drop of, the one drop is enough. Provided it drops inside, it is just enough. Then, of course, close your eye. Do not rub and try not to blink. Just close so that you can allow the medicine to move around the eye uniformly. Then wait for at least 5 minutes. If you are to administer another eye drop. Sometimes you have more than one medicine to put in your eyes. Okay, so you wait for about 5 minutes and then open the other one and also put just a drop. So this is also how to instill the eye ointment. Sometimes we give you eye drop and then an ointment. So you still go through the same process. You wash your hands, then you gently pull down the lower eyelid and make that small pockets in the eye. And then you squeeze out the medicine and then into that lower pocket. And then blink to spread the medicine. So thank you. This is all I had to share.
Yes, thank you, Dr. Betty. Thank you very much. Dr. Crescent, are you here? Dr. Crescent is our moderator today, but I don't see him on chat. Maybe he dropped off. Dr. Crescent, are you there? Okay. So you can put your questions on chat or raise your hands to be able to ask them as we get Dr. Crescent on. Dr. Betty, thank you very much. I didn't know that there were different types of the red eyes. I thought they were the same. But there are a number of questions on chat for you. Dr. Clet, please help me call Dr. Crescent. Yeah, so I will read the questions for you, Dr. Betty, that are on chat, and then we'll also allow those who have raised their hands to ask their questions. So the first question that I saw on chat, I'm trying to get it. Is that somebody asked, is it also related to yellow eyes? Somebody asked if it is related to yellow eyes, the red eyes, if they're related to yellow eyes in any way. She says because the symptoms come in the same way. Another one says that you please elaborate on the neonatal. Now that's why I need Dr. Crescent. Some of these things I can't read them. That you please elaborate more on the neonatal conjunctivitis, especially the cause coming from the delivery process, like you said, that the baby gets infected by the infected mother. And then they're asking what you would prescribe for bacterial conjunctivitis for a baby with 6 to 12 months. I would request that you go through those so that we don't have many at a time. After we have read those on chat, then we'll take questions. Dr. Crescent, if you're back, please say that you're back. Okay. Dr. Betty, you can then answer those three questions shown on chat, and then we take the other three. Please raise your hand if you'd like to ask, so that you can be asked to unmute. Dr. Betty, over to you. Dr. Betty, are you there?
Yes. Thank you so much.
Okay.
Yeah, thank you. Yeah, okay. So we shall go with the question. One of them was is yellow fever, is it yellow eyes related to to red eyes? Okay. There's yes, the yellow the yellow fever or yellow eyes, of course, is caused by a virus also, but it is not what we are seeing right now. Okay, it's not what we're seeing right now because the other one is caused by, it's transmitted by vectors, of course, such as mosquitoes, and it's transmitted through a human bite of infected mosquitoes, of yellow fever. So it causes the yellow fever, and then of course the mucous membranes, the eyes, the mucous membrane in the mouth and everywhere becomes yellow, but it is not really this red eyes. This one is usually caused by the epidemic that we're seeing around is caused by these adenoviruses. Then somebody wanted me to elaborate more about neonatal conjunctivitis. So, like I said, what are neonates? These are children of 0 age to 28 days. So, if they are born normally through the birth canal, so usually the birth canal might be infected, the birth canal of the mother might be having those microorganisms. They, of course, the Neisseria gonorrhea, the chlamydia trachomatis. So if they are in the vaginal canal there, and then this baby passes through, might contract. But it's not that everyone who goes through a birth canal that is having those microorganisms must contract that those neonatal conjunctivitis, but that is ideally how they get the neonatal conjunctivitis. So it usually comes in the first day to 7 days. You start seeing the symptoms, and sometimes it can go actually even to the 3rd week. Then you start seeing these symptoms of the reddening, the discharge, and the eyelids swelling of this newborn baby. And then the other question is the bacterial, the treatment given to bacterial conjunctivitis. As the name states, bacterial conjunctivitis, bacteria, so it's caused by the bacteria. Ideally, we say it is self-limiting. If everything remained constant and we don't have these immunity issues and what, that would clear itself. It would come within a week or two, and then it eliminates itself and you come back to normal. But sometimes these symptoms are so disturbing, and then we are not sure of our environment, whether we are having multiple microorganisms, and then before we know, you lose your vision. And so that's why we come in and treat, because we've seen some people lose their vision simply saying, I started having red eye itching, and then I thought it was going to go, or they're using wrong medications and what, and then they end up losing their vision. So we usually give antibiotics, antibiotic eye drops and ointments, and sometimes we have to go even systemic, because for example, if we have a gonorrhea, gonococcal conjunctivitis, red eyes caused by the gonorrhea virus, where we shall even have symptoms also a patient having difficult passing urine and what, so we shall now give the systemic antibiotics. Thank you.
Thank you, Dr. Betty, for the presentation and for answering the questions. Thank you, members, for being attentive throughout the session. We have over 115 participants here on Zoom, but we're also live on YouTube. and we have participants there and questions there. I can see a number of questions in the chat, and I am sure Dr. Betty can also see some of them. But picked so far, doctor, that you can chip in and answer. You need to answer to this. First, the compliment. Araki says, thank you so much for saving his eyes at Mengo Hospital. Real specialist in that area. You saved his eyes from
Dr. Christian, we've lost you. But thank you so much for the compliment.
blind. So thank you. There's a question on how do you define caused conjunctivitis? How do you differentiate viral conjunctivitis from allergic conjunctivitis? That question is from
Hello, hello. Unfortunately, I can't hear anymore. I don't know what has happened. If you're hearing me, and I had asked that question, so I really needed to hear the answer. I don't hear anything. Hello, Dr. Crescent or Dr. Betty, you are off. I've not heard anything. I don't hear anything.
Yes, please. You're the one who asked how do you get to know the difference between viral and allergic conjunctivitis?
Yes, please. Yes.
Oh,
And now I
okay.
can hear you.
Okay, okay, thank you. So, it is not very easy to differentiate, but there are some leading factors that can make you realize that this is a viral and this is an allergic one, because there's no, we cannot test these allergens yet to see. But usually, like we've told you that the viral conjunctivitis is usually contagious. So somebody will tell you that actually my neighbor or my workmate had the similar symptoms, and we've said it usually begins with one eye and eventually spreads to the other. And of course, there is a discharge which is usually clear, a clear discharge, watering, that is in a viral. Then in allergic conjunctivitis, like the word allergy states, like somebody is allergic to something. So there will be leading symptoms, like these symptoms worsen in the cold, these symptoms worsen when I'm in dust, or these symptoms may be like the pollen grains or something. So there will always be leading symptoms that will make you realize that this must be viral, this must be an allergic. Of course, now with allergy, we don't have a definitive treatment as well, and of course, for it will go on for long. The viral, we expect it for a short time, 1, 2 weeks, three, it has cleared. But for allergies, definitely they will keep on. If they are seasonal, if they are perennial, they will still come and go, come and go. So eventually you have to make a diagnosis of the allergy. Of course, there is usually no discharge unless there is a secondary bacterial infection in the allergic conjunctivitis. But the other symptoms may be similar, the redness, the itching. Yeah, so I hope I have helped you answer that. But always refer those patients to the clinician so that they help you to differentiate for you whether this is a viral conjunctivitis or this is an allergy, red eye, something. Thank you.
Thank you.
Thank you.
Thank you, Betty. There's a question on instead of using a cloth, can I compress my eyes using cotton wool? And then the other question, you talked about washing with hot water and detergent, the bed sheets and pillowcases and so on. What if I wash them with cold water and detergent and then after that I iron them? Then my son has a discharge, but the eyes are not red. There's no redness of eyes. Is that also red eyes? Please take those ones on. Thanks.
Okay, thank you so much, Dr. Crescent. So I'll begin with, I like the questions because it shows that people are really attentive and then this is really a public health concern and people would really want to know. So this is encouraging. So when we talk of clothes, okay, instead of using the hot water and what about if we use the cold water and the detergent and wash? Yes, just like I've said, clean water and soap is sufficient enough. So if we wash well our clothes, our handkerchiefs, and then iron them, that would be good enough. But if we can, then we use hot water. But cold water with soap, and then with ironing, and it is good enough, surely. It will kill these germs and it shall be good. And then instead of, okay, this one of using cotton wool instead of a cloth. Okay, that is if by choice. I think it has no problem because you're closing the good thing is you're closing your eye, so this thing is not supposed to be in your eye open. So you have closed the eyes and you're placing on top of your eyes. So it is okay because even we have encouraged people to wash their faces. We usually get children and other people who are having these severe symptoms of allergies, and you must have had, if you've come around, we usually encourage them to wash their faces with cold water. So anything that can put cold water on your face, if you want to use your hand and you close, and then if you want to use a hanky, if you want to use provided it is clean, then there's no problem. Even you can just wash your face with cold water. Close your eyes and wash your face. We're not saying pour water into your eyes because now you put more microorganisms into your eyes and then you say, but the doctors told me to wash my face. I told them my eyes were itching and they told me to wash my face with cold water, meaning I pour water in the eyes. No. Close your eyes and then wash your face with cold water. Then
Thank you.
yeah, this
Thank
one with
you.
an eye discharge. This one
Yes.
with an eye discharge, but is not having red eyes. You know, there is something interesting because we have an epidemic of the red eyes, but it is not stopping other diseases from occurring. So this could be another thing altogether. It could be, as we say, red eyes. It doesn't mean that all is red. No, you might actually have a discharge and then there's this discomfort, there's irritation, but actually the redness has not come. Maybe it's going to come in tomorrow. Or it is actually something very different. Maybe it's an allergy or it is actually a bacterial infection, but it is not causing a discharge. We've seen very many patients having eye discharges without the redness, and then we diagnose a bacterial infection or even a viral infection might be there, but there is no redness. So these symptoms here are not clear cut. They are not saying that they all must be there. I told you from the beginning that all these symptoms will not appear at once. You might find one with one symptom. And like I've also told you, the causes of red eyes are so many, the causes of eye discharges as well as so many. So I will not tell you that that patient has red eyes until we have examined them and exhausted the other differentials that can cause the discharge. Thank you.
Thank you, Doctor, for answering those questions. There's the question of where do I go for treatment if I have red eyes? Do I go to any medical personnel or a specific specialist? Must I go to an ophthalmologist, or other cadres can also effectively handle a case of red eyes? If I have suffered from red eyes, I've been treated and I have healed, can I get reinfected again? And after how long? Or if I get it, it is once and for all, and that will be it. The third question is about the eye drops. Once the eye drops have been opened, for how long can it be used? Can the eye drop be used? I think it's a general question, not necessarily on eye drops, or rather on red eyes. But in general terms, if I have opened the eye drop, can I use it for 3 days? Then I keep, then I can give it to someone, they use until it is done, or once opened, use for 24 hours, discard. What is the guideline there? Thank you. After you have answered those, I will allow Flavia to unmute and ask her question.
Thank you, Dr. Crescent. And Doctor, I had a question. Are there any home remedies we can use? Because I, for one, have faced a challenge of finding the medicines in outlets. They're almost out of stock everywhere. I think the demand is so high. Are there any home remedies we may consider that you can recommend? Thank you.
Thank you, Flavia. I think, Doctor, you can take on those. Those who have further questions, please paste them in the chat, or you can raise your hand, I'll pick you up. Dr. Betty.
Okay. Thank you so much, Dr. Kristen. Thank you, people who are asking questions. So one is, where do I get medicine? Must I go to an eye doctor if I have the red eyes? Well, what do I have to say? I would say yes. You would really need to visit an eye doctor, because now let's say you're going to visit a general practitioner or another cadre or another specialist. This is an ENT surgeon or a neurosurgeon or a gyne. Then, well, they might be able to treat, because this information is everywhere, but sometimes, of course, we are not good at looking for this information. So I'm imagining you're going to come in, you might not get all the necessary information that you're supposed to get, because I don't think any other cadre will have all this information that we are telling you, the preventive measures, the precautions to take, the exact medications, because you'll come with red eyes, all they want is to clear the redness. They might not go into details to know, is this a viral? Is this a bacterial? Is this an allergic conjunctivitis? Could it be actually due to trauma? You know, like I've told you, that the causes of red eyes are many, very, very many, other than what we have listed here. So one will want to, so who has the time other than the eye doctors will give you that time to listen, to know what caused this red eye, because we really go into details of the history and the examination. Those who have visited the eye clinics, you know, the machines that we use to examine your eyes, I don't think they are in other specialties. So I would encourage everyone to visit the eye doctors. And surely it is good, even when you don't have red eyes, I would encourage everyone to have an eye examination, an eye checkup, or at least twice a year. At least if there is no any other issue, twice a year is a good one for you to get examined. So I would encourage everyone not to just go on moving to other places. You are meeting an OBGYN, you're asking them for eye medication. Fine for them, they might manage the symptoms, not because they cannot get the other information. But remember, when one has specialized, now, like right now, I'll not tell you the current medicines in what they're using in preventing the pressures or what in the by like a physician would. So, but I can treat pressure, I can treat blood pressure, I can manage. So, but I might not know the current trends. So I would encourage everyone to visit the specialists, really, the eye doctors, the eye clinicians, to avoid the other unnecessary side effects. Then when I've got red eyes, does it mean that I'll not have it again? No, there's no immunity that now you have got red eyes, so you'll not get it again. You can get it again and again. And then for home remedies, surely I had mentioned them earlier in my presentation. We have talked of the cold compress that we're trying to describe. It is a home remedy. We are not going to do it for you in the hospital. We shall only show you how to do it. We shall tell you if you have allergies. We shall tell you to avoid the causative or things. Maybe is it the cold? Is it the is it the dust, so you avoid it. Then of course we shall encourage everyone with those red eyes because they are itching and what we are administering artificial tears. So we are going to encourage you to stay in isolation so that you don't pass it on to others. You have to take plenty of fluids because most of the people with red eyes actually, especially this viral one, they'll tell you that actually I had maybe a cough or a flu, so an upper respiratory tract infection causing a pharyngitis and what. So there will be all that. So we shall tell you to really take plenty of fluids, eat a balanced diet, and take care of yourself well. Wash your face regularly, wash your hands regularly. And those are some of the remedies. Thank you.
Thank you, Dr. Betty. Allow me, members, to recognize the following personnel who are with us in this session. I want to recognize and welcome Coleman Ayebwa, who is a senior researcher at the Medical Research Council, Masaka. I've seen him here with us, who is and the procedure at the Ministry of Health. You know, TB can also catch the eyes, and it causes TB red eyes. So she's also here with us. We also have Dr. Astasela Ignatius from our sister association, covering Kampala Catholic Residents Association, and is the head of health in that association. Thank you so much for being with us in this discussion this evening. I have a hand from Frank. Frank, please unmute and shoot.
Thank you, Dr. Crescent and Dr. Betty. This has been wonderful and so informative. My question is mainly on Dr. Betty's presentation. She indicated when you administering a drop or the drops as per the prescription, that when you put in a drop, let's say into the eye, you wait for at least 5 minutes. You close the eye for at least 5 minutes. So I'm inquiring if you were given a prescription for 2 drops, does it mean that you also do it at intervals? You first administer one, you put in one, and then you close for like 5 minutes. Then you again put in a second drop, or you first put in the 2 drops and then you close at once. Thank you.
Thank you so
Thank you,
much.
Frank. Let's take the question from Rose. Rose, please unmute. And Frank, you can now lower your hand. If you have put your question in the chat, be sure it will be answered. Yes, Rose.
Good evening, doctors. My question goes, which specific antibiotics or eye drops are used for treatment of red eyes? Thank you.
Thank you for your question. I hope this will not tempt us to prescribe medication online without seeing the patient, but the doctor will be able to answer that question. There is a question here in the chat, and I'm going to nominate someone to answer it if he's still around. Dr. Ampe Gaston, there's a question I want to direct to you it's in the chat. And the question goes that some schools send victims back home, and some parents say victims would rather stay at school since they contracted it from school. How best can we handle this? Dr. Ampe is a professor in Makerere, so he has dealt with the students for a long period of time. He's also a parent, so he'll be able to answer that question on our behalf. The person who is asking for a summary. The person is asking for a summary of
hands has been a key message that the ministry is focusing on. In terms of studies, I will not speak for that. I'm not very sure of what studies are happening now, but we are mainly focusing on the prevention and control of the outbreak. Over.
Thank you, Doctor, for chipping in. So can we have Estriahebwa?
Okay, thank you so much for this informative presentation. I have 2 questions. One, what is the relationship between the eye and the ear? I think because most of the time it's like the same medicine. Secondly, when someone was talking of 5 minutes closing of the eye after the eye drop, I have a nasty experience whereby, you know, I was given an eye drop in one of the hospitals in town. And I was like, I was not seeing for the rest 30 minutes. So after 30 minutes, that's when I started seeing. So I don't know. It was a nasty experience with that eye drop. And if anything, now I fear those medicines. Thank you. What do you say about that? Thank you.
Thank you for your question. Let's get the question from Sarah as we wind up. Sarah, please unmute.
Good evening, everyone. I'm just curious, and because curiosity that is real, but I wanted to know, because my daughter and my son are having this discharge, but it's not too much. It started some 3 days back, but they don't have the redness in the eyes. And someone was telling me that should be red eyes. So I just want to get clarification. Is it red eyes or?
Sarah, that question was answered. You put it in the chat. And the Dr. Ebri answered that question. There are not many questions in the chat that have been answered, apart from the issue of sharing eye drops. Is it recommended to share eye drops, and for how long can the eye drops be kept? I think, Doctor, you can answer those, and then we shall go into the final roundup. Dr. Betty?
Yes, please, Dr. Crescent. I'm present. Yeah, thank you. Yeah, I think we missed, one of the questions which was saying if one has used the eye drop and maybe for 3 days, then can they keep it, and after weeks or months, can they reuse it again? Well, I would say no. And okay, most of the times that medicine is supposed to be open. Once it is opened, then it can be viable for about 1 month. So you can use it within 1 month, and after that, please discard it. That's why some patients have come here to hospital, and then we have told them, they show us their medicine. I had this eye drop I was using the other month, and I'd just use it for 2 days, then I kept it, so can I use it again now? We usually tell them no, please. So we usually encourage to use it within just a month. And also please take note that these medicines, most of them have leaflets. They have leaflets. That is very good information in those leaflets. How I wish you take your time and read those leaflets. That's just free information that you can look at. So in those leaflets, they will always put for you the time for those eye drops, how long they can stay after they have opened them. Not only eye drops, any other medicine, like we use syrups for the children and what, they usually have leaflets. And those leaflets is very important information for us to have. So the other question was, how is the eye connected to the ear? I don't know if I go into the anatomy, we might not get it, but yes, most of these organs actually on the head are connected. You'll be surprised if I told you that actually the brain is connected to the eye. So the eyes are connected to the brain, the eyes are connected to the nose. That's why you see when you're tearing, when you're tearing, most of the times you get even a runny nose. Why do you think that comes about? Because that is a clear example I could give other than the ears, because it is more of anatomy, the nerves and how they are connected. But what I wanted to bring out clearly here is these organs are interconnected, especially on the head. So you realize that when you cry, your nose is dripping, is having, because these tears, most of, naturally, under normal circumstances, our tears, we produce tears every other time, every other minute, every other second, we are producing
just
tears.
a moment, doctor. Just a moment. Please, Maria, help us to sort out the problem that we have. I think we have a problem. Checking the chat and help us out. Doctor, you can proceed.
Okay, thank you. So yeah, in short, these organs are intertwined. So actually, if you look at those eardrops, most of them are written on ear, eye, and nose. Nose eye drops. So those organs are joined up together. Then I did not get the second question from this person who asked about the ears being connected to the eye drop. She gave a scenario of she went to a shop in town, a pharmacy or something. Then she got this eye drop. Then she stopped seeing for some 30 minutes. So I did not get the question. Dr. Crescent, are you here?
I see is muted.
Yeah, Maria, you can help me to get the other question because I didn't get the question from the person who asked about. I had the scenario, but I did not get. I missed out on the question.
Which scenario was that?
I think she was asking about the last question. I think she missed it.
Thank you, doctor. Maybe the person who asked the last question, I don't know the order in which they were, or which one is the last. Is it about how the ears are connected to the eyes? Because they usually have the same eye drops, that the eye drops for eyes and the ears are the same. Why are they the same? The question, the last question was from Sarah. You had answered that question, which was regarding the children who have discharges, but the eyes are not red. So she was wondering whether that is also red eyes. That question is in the chat, and you had ably answered that question. Members, we are coming towards the end of our session. I want to thank you so much for your time. I want to thank you so much for your patience, and for all those who asked the questions. I want to thank you so much. I'm the Health Council, the members, the executive. Thank you so much for planning and for executing it. I also want to announce that for those who may not be aware, we have our upcoming medical camp that is going to be in Lushoka, that is in Tungamo district, and the date will be the 7th of September. It has been approved by the authorities and it is going to happen, and we shall do a lot to do with the eyes, including eye surgeries and so on and so forth. I also want to thank the members of the Executive Council who have attended this session. And I don't know if Vice Chair is still on the chat. At some point, I will need her to give remarks. But before that, Dr. Betty, please give us your parting shots or take home messages as we conclude. Dr. Betty is not here. Is she here? Dr. Betty, I'm asking you to unmute and give us your concluding remarks.
Okay, thank you so much, Dr. Crescent. Okay, thank you so much. While I was delaying, I was unable to unmute. I think the host had disabled the unmuting bit. So thank you everyone for the great attendance. I'm really honored and humbled. I hope I've been clear. The take-home message is we should not worry because this is we get this infection, but it is for a very short time, although you can get infected again, but it is for a short time. And the good news is it is self-limiting, even without treatment, but we usually have to treat the symptoms. So make sure you see an eye clinician, and we also it is easily preventable. Like I told you, it is like the COVID virus. So we have to wash our hands. We have to avoid contact of infected people or minimize, and we have to isolate those who are sick, not in bad faith, but to help not to spread it to the other people until the symptoms have cleared. And treat those who are sick, give them the remedies, manage them at home well. And yeah, thank you so much.
Thank you, Dr. Betty. I want to invite Raymond Karamaji to give a vote of thanks. He may not know that name. RK, I'm giving you an opportunity to thank your doctor. RK is not here.
No, he's here. Let me give him permission to unmute. We know we had to limit. Okay. I
Yeah,
think he can
thank you
speak
so
now.
much. Am I audible?
Yes, you are.
Thank you so much, Dr. Crescent and Dr. Betty and all other medical professionals that have given us a good session this evening. Before I go ahead with thanking my Dr. Crescent, I also wish to recognize the presence of Dr. Deus Mumanjizi, who is at the World Health Organization headquarters. He has been with us on the session. So I think from the larger perspective, it has been a rich, enriching session. We have taken lessons, and I think we shall continue to be safe and continue to look out against this red eyes that has engulfed Kampala, especially with the school children. So without wasting any more time, thank you so much, and we look forward for further engagements and as you educate us to live a healthier life. Thank you so much and have a good night.
Thank you, RK. I've been actually looking out for Deus. I don't know why I kept missing him. Before I invite the Secretary General to close, let me give Deus the chance to say hello to us.
Yeah, thank you so much. I had intended to remain incognito here, but I don't know who has fished me out. Anyway, let me take this opportunity to thank the AMDA Health Council for this indeed important session. I think this is one of the most important public health intervention, that is spreading information and awareness so that people can, in the first case, prevent the spread of such a disease. And I thank Dr. Betty for the wonderful presentation. And I hope we have all grasped what she has shared, and we can prevent the further spread and also reduce the anxiety that may be the mothers and the parents are facing with this outbreak. But as you've heard, once we take these measures, we should be self-limiting, and we should be able to contain this as quickly as possible. Thank you so much.
Thank you, Dr. Deus. I am going to request, after the closing remarks from the Secretary General, I'm going to request a volunteer from Lushoka to give us a closing prayer. But before that, I want to recognize and thank my team that have planned this and made it happen. Dr. Allen, my very wonderful assistant, Dr. Allen Basima, Cleo, our chief mobilizer, Sime Caroline, our Secretary General for the Council. You can say Junior Secretary General, and the Clet, the Head of Outreach. I'm the Health Council. So let me invite Engineer Anthony to give us his remarks and close out this session before we get a closing prayer from Lushoka. Thank you.
Thank you very much, Dr. Crescent and our moderator this evening. Good evening, friends. On behalf of the AMUDA EXCO, I would like to pass on our thanks, first and foremost, to Dr. Betty Katendre for sparing the precious time this evening to educate us on a subject that is timely and also affecting all of us. Thank you once again. And also to thank the Health and Wellness Council, led by Dr. Crescent Ise, for putting this together right on time again, and for ensuring that we have an interest in our health as one of the 7 pillars of the AMDA community, but also ensuring that we have first-hand information on an epidemic or a disease that is ravaging the country, and we believe that we are better armed now than we were before 8:30 this evening. Lastly, I want to thank everyone who joined in. We had very many people joining in, over 100 from different walks of life. I know we had Rotarians here. In the chat, I could tell that there were many doctors here, even ophthalmologists, both AMDA members and non-AMDA members. And that shows the interest in the current disease spreading through Uganda of red eyes, the interest that we have in it, and most importantly, the care and effort we want to put into ensuring that when we get it, we manage it as quickly as possible, prevent the spread, also most importantly, prevent against contracting it. And like Dr. Betty said, we can get it over and over again. So even when we suffered from it, the arming is essential to ensure that we do not get it again. Because this was a public event where we invited everyone far and wide, I would like to apologize for the